You made, over the course of the November campaigns, health care the sort of defining issue, repeal of Obamacare.
Yes.
I want to talk at a pure policy level now about something, we don't have a lot of time, something called about the individual mandate, which you said is a horror, right? Everybody is against it. Now, I want to quote today, or I'm not going to quote it, restate a conservative columnist who said, if we all want pre-existing conditions to be covered, and we want somehow to have greater coverage, you must have an individual mandate, because otherwise the people who don't pay are free riders on the system. We're merely saying to people, pay your own freight.
Okay.
That's the conservative view. Mitt Romney bought it, conservative column. Why is that logic wrong?
I'm not saying that. I don't know if that logic is wrong or right. My argument on health care has always been the way this administration has approached health care was to throw it all in there and without any idea or recourse to spending and how we're going to pay for it. Now, you tell me, how do you pay for adding 30 million or 50 million new people to a health care system?
I'll show
How do you
right
pay
now.
for it without raising taxes or without burdening small business owners?
I'll show you right now. One, the Congressional Budget Office, and let's...
The Congressional Budget Office is only as good as the information you put into it, and you know that.
That's
so if you put in faulty information, you're going to get a faulty response.
Garbage in, garbage out, as we say. But the CBO, which has been looked to by both parties, says it will save hundreds of billions of dollars because, and here's the critical reason, it will rationalize the delivery of health care. The people who are uninsured are getting
health care. It was
healthcare.
already rationalized. What do you mean? You were talking about capturing 30 million people who weren't in the system. And the question before the country at that time by this president was, well, we got to bring these 30 million people in. So the next response was, okay, how do you do that? That question was never answered, and then we got onto all this other stuff.
Here's the misconception, and I say this as somebody who, when I was in government, dealt with trying to restructure health care a little bit.
Right.
The people who are not covered by insurance right now, I'm drawing a circle here on the, are getting health insurance. They're getting it through the emergency room.
Right.
They're getting it through the worst form of delivery because it's not rationalized, and everybody else is paying for it because the hospitals that give them that care have to be compensated. What this system does is says these 30 million people, will contribute, and therefore everybody else not only saves money because their taxes and premiums can go down, but more important, the care this 30 million receives will be rationally delivered.
So how much are they contributing? And how come they weren't contributing before?
That's what the individual mandate's about. That's what the individual mandate is about, and that's why conservatives, including Mitt Romney, are for it. And that's why the logic of it seems overwhelming on both sides of the aisle. Why is that logic wrong?
Well, I'm not saying the logic is wrong, but the logic can be right, but the cost can be a real pain in the you-know-what.
Well, but we're saving money. Look,
you didn't show. You drew a circle. You're not showing me how you save any money. Where's the savings? Where's the savings? I see no savings. I see a circle with an arrow.
Michael, you acknowledged the logic was pretty compelling. Let me just say
this. I'm all for logic. I want to know how much it's going to cost me and my family and my business.
We've reached
and that question is yet to be answered by this administration.
This is a good news interview because we agreed that we both like logic, and you agree the logic of this.